It did work out this morning. Oh well.
That's a good thing, though, right?
Trying.
Yeah.
Trying. I want to see 69.
Well, we love to see 69. That's awesome. We're getting lots of people signing on right now, so I'm just going to give it a few more seconds and we'll start.
Wow.
Okay. Well, it looks like we have quite a few participants. We're expecting a lot more, and so I think we're going to be getting a lot more logging on, but just my team, are we ready to go? Okay. All right. Well, good morning, everyone. My name is Dawn Kraus, President of Leadership Seminole, and it is my pleasure to welcome you to Lessons on Leadership. I can't believe what a beautiful day we finally have today, so hopefully we'll all be able to go out and enjoy this beautiful weather this weekend. We are so fortunate to be able to have our experts who are going to share with us what's going on with COVID-19. We're happy that we're going to be talking about how to, debunk all the myths that we hear, what lessons have been learned so far, and where do we see ourselves going in the next months or so. But before that, I'd like to take the opportunity to thank our sponsors. First, to our presenting sponsor, Orlando Health South Seminole, for being our presenting sponsor through the series this year. Thank you so much. And to Professional Real Estate Company for being our supporting sponsor. At this time, I'd like to take a moment to hear from our presenting sponsor, Orlando Health South Seminole.
Hello, I'm Sean Molsberger, Senior Vice President of Orlando Health and President of Orlando Health South Seminole Hospital. As a member of the incoming Class 30 of Leadership Seminole, I know that the experience will bring many new connections and insights, just as I am sure you all will find from today's program. Orlando Health is proud to be a partner of Leadership Seminole and excited to play a role in bringing important content like this through the Lessons on Leadership program. As you will see today, when a team of experts from different areas come together to address an issue, great progress can happen. This is what we have at Orlando Health, a collaborative team of experts from hundreds of specialties, all working towards one common goal, to improve the health and well-being of the individuals and the communities we serve. If you have a healthcare need, don't delay. Orlando Health has 9 hospitals, 15 adult and pediatric ERs, 11 urgent care centers, and over 100 physician practices throughout Central Florida, maintaining the highest levels of infection prevention to serve your needs. Thank you for allowing us to be a part of your health and leadership journey, and stay well.
While never to be taken for granted, safety and protection at our facilities for patients, loved ones, and employees is without question. Our commitment is unwavering, and that won't stop. We're confident that Orlando Health is the safest environment for giving and receiving care. And while our gowns and gloves, glasses and masks may hide our smiles, it's the compassion and care that shines through.
Well, thank you, Orlando Health South Seminole, for that wonderful sponsor message. So we're just about to get started, but I wanted to remind everyone that we will be taking questions at towards the end of the program. So if there's something you would like to ask our panel, please go to the chat box at the bottom of your screen and put in your question, and we'll do our best to get to all the questions that we can. With that, I'd like to go and introduce you to the Chair of Lessons on Leadership, Jeremiah Fuller, who's going to introduce our special panelists.
Thank you, Dawn. I hope everybody's doing great today. I know it's been a while since we've had the Lessons on Leadership, and although we wish we could be in person, I'm glad that you could all join us on this beautiful Friday. We have assembled a great team of panelists that are going to answer some awesome questions. So without further ado, let me introduce the panelists, starting with Alan Harris, who's the Chief Administrator for Seminole County Office of Emergency Management. We have Dr. Todd HUSTY, President and Medical Director for the Medical Audit Resource Services. Dr. EDGAR SANCHEZ, Infectious Diseases and Internal Medicine at Orlando Health. And DONNA WALSH, Health Officer for Florida Department of Health in Seminole County. So we'll get into the first question, which is kind of in the myths and dispelling them. Many of us are hoping to get back to some kind of normalcy, but we still have some degree of fear about the virus. What are some of the most common myths that need to be debunked right now about COVID-19?
Okay, gang. Dr. Sanchez, you're muted. Donna, you're muted. Alan, you're muted. I'm not. So I guess I'll start. If you'd asked me this question a week and a half ago, I would have said that the myth was that it can't be beat. We were so close to beating it. The myth now is that it can come back. The myth is it can't come back. And unfortunately, what we're seeing is that it can. So I think that's probably the take-home message of all, is that it can come back. And if we don't do the right things, it'll come back with a vengeance.
Good morning. This is Donna Walsh with the Health Department. Thank you for that, Dr. HUSTY. Certainly, as you said on our press conference yesterday, we were very hopeful. We were averaging 0 to 5 cases a day for a couple of weeks there. And then we went from 8 cases one day to almost, over 30 the next. And we've been hovering at 30 cases for the last 3 days. So, the myth of this is just going to go away very quickly that's certainly not the case. The virus is still circulating in our community. It's still circulating statewide, nationwide, and worldwide, honestly. And, we have seen, because of the number of deaths statewide and in the nation, and certainly throughout the world, as this virus has taken off in many countries, it's very different than the seasonal flu. It's very different than the common cold. We don't normally see deaths associated with the common cold. We do see deaths associated with flu every flu season, but not to the level that we're seeing here. Our only defense, honestly, at this moment with this particular strain of coronavirus is the infection control measures that we've been talking about for several months now, with keeping your social distance at least 6 feet away, wearing the covering or the face mask to protect others around you. And of course, all the infection control measures our hospital specialists comply with every day to protect their patients and coworkers. So this, unfortunately, until a vaccine comes along, that's our defense. This is not simply a common cold that everybody can get over and move on. As we learn more about this virus, other things such as the multi-system inflammatory syndrome that we're seeing in children and pediatrics is starting to become more known, and we're learning more about this particular syndrome, and it can also be fatal in children, although numbers are very low right now, and I'll let the medical professionals, Dr. Sanchez, Dr. HUSTY, talk to that. But we're learning even more about this particular virus and the complications it can cause. Another myth, I know we've talked a lot about those who are elderly and those with underlying conditions being the ones that would suffer most complications and even death. But it doesn't mean that not anybody can get this, because anybody can be exposed and get this virus. There's also a myth out there that if you don't have symptoms and you're positive, that you can't pass it along. And I know recently you've seen some different guidance articles come out from our healthcare professionals nationally and worldwide that perhaps that might not be the case, that may be the case. But at the end of the day, there certainly is enough scientific evidence to show that there is a possibility that someone without symptoms with the virus can potentially spread it. Especially those people who do show symptoms, they're most infectious a couple days before their symptoms even start through that period of time. So I will turn this over to Dr. Sanchez, and he will talk to you further on a medical level of what other myths that they may be seeing in hospital settings.
Hi, good afternoon. Good morning. First of all, I want to thank everybody for having me here to speak on this topic. While I am an infectious diseases physician, and my main campus is in South Seminole Hospital, but I have taken care of other patients throughout the whole Orlando health system, including in Orlando Regional Medical Center downtown, Dr. Phillips, South Lake. So as such, I've seen a multitude of patients with symptoms ranging from mild, those so-called mild symptoms, fevers, chills, without the pneumonia, to the critically ill, severe patients with severe symptoms that have required intubation and ventilation. And one of the biggest myths I've heard and seen is that, well, I'm relatively healthy, I'm not going to get that severe disease, and nothing could be further from the truth. Well, it's true that people with a lot of comorbidities are more likely to get that severe disease that require intubation, that severe pneumonia, shortness of breath. Young people without any of those comorbidities, I've seen them also get very sick very quickly, 30-year-olds and 40-year-olds. And some people, like most of us, don't realize we even have a comorbidity sometimes. We don't know we have high blood pressure. We don't know we have diabetes. A lot of us don't go to the doctor as much as we should. So we all have to be very careful. And then secondly, the mild disease that everybody just kind of puts aside and says, oh, I'm just going to get a simple fever and cough. That can be very debilitating. I've seen people with those same symptoms for 3 to 4 weeks. Those are 3 to 4 weeks where you stay home, where you have to be isolated, stay home from work. And as such, a lot of these patients keep coming back and saying, like 1, 2 weeks later, hey, when are these symptoms ever going to go away? So even in the case of those, quote, mild symptoms, it can really affect your life. So I really urge everybody to take this virus seriously and to do everything they can to try to prevent from getting it.
From Seminole County government, I think that the one myth that we continue to fight against is that that it's mutually exclusive to reopen and be safe. We truly believe that the economy can rebound, that things can reopen if we do it safely. We in Seminole County had an executive order specifically for social distancing. We never closed any businesses in this county. No executive order that we ever issued closed a business because we didn't believe that was the correct method. We believed always in social distancing, frequent hand washing, facial masks and coverings, things like that that would help prevent the spread of the virus. Unfortunately, there is a lot of individuals that think that that are on opposite extremes. Either open everything up and no social distancing or any measures whatsoever, or the other side. And you can do both at the exact same time. You can reopen, and you can be safe, and you can prevent the spread of the virus all at the exact same time. One of the other myths, of course, is that COVID is gone, and clearly we're seeing that that is absolutely not the case. And we had a conversation yesterday regionally. We have a call each week with Mayor Demings, the chairmen of Lake and Osceola County, here in Seminole County, Chairman Zimbauer, all the emergency managers. We get on the phone and we talk about trends, and clearly we are seeing a upward trend now of individuals getting COVID-19. A majority of those individuals were not doing what we say, and that is encouraging facial coverings, social distancing, frequent hand washing. Many of them have said that they stopped those types of activities because the news changed, so they changed their behavior. So our message, of course, is that it's still out there, and to continue to social distance and continue to practice hand washing and facial coverings.
Thank you all so much. Speaking about masks, there's been stuff in the news from the World Health Organization, the CDC guidelines. Do we need masks? If so, what's the proper way to wear them? What's the proper etiquette we should be following in public and private spaces? Just trying to get a better understanding on the mask wearing.
Masks work. That was going to be my other myth I was going to approach, because there's so many people that think that masks don't do anything. Indeed, a regular cloth mask, which is usually 2 layers of cloth, it does something for keeping the person wearing it from getting infected, from being exposed, but it does a whole bunch more for everybody else. And that's the hard part about this, is that it's not about what it does for you, it's for what you do for everybody else. I had the opportunity when I was in the Navy to go to Tokyo, and we were riding the trains in Tokyo, my buddies from the hospital and I, and we couldn't figure out, what are all these people doing? These people with these masks on their face. I said, are they paranoid or what? They weren't paranoid. They were the ones that felt a little bit sick and didn't want to make everybody else sick. It's a whole different headset. They take care of each other. They look out for each other. They do not want to expose each other. Yesterday, I used the analogy that when you get that email from Nigeria about how you can make tens of millions of dollars, you don't share that with everybody else. You don't send it to your family. You don't put it on Facebook. You don't send it to all your friends, because it could have a virus in it. So wearing of masks is basically the same thing. It's not as much to prevent you from being ill if you're wearing a regular cloth mask or a facial covering. It's really to keep everybody else from being exposed. And that works. There are good studies out there that say that, and especially that combined with social distancing, good hand washing, all the things that we know work, you do them all, and you can knock this thing down. We were so close to zero. What do you think, Dr. Sanchez?
I completely agree. If you are in a position where you can't stay social distance, that means you can't be in a space 6 feet away from somebody else, you should definitely be wearing a mask for as much as possible. And that means covering the face, the nose. This way you can stop the spread of the virus if you happen to have it. And as we've talked about, a lot of people who spread the virus are asymptomatic or something called pre-symptomatic. They haven't developed the symptoms yet. And so you'd hate to be the one to have spread it to other people. God forbid you are a carrier.
Well, this is Donna. I would just like to add too, I know that there's a lot of confusion in the general public around the cloth mask that we wear each and every day and what our medical professionals wear in a hospital setting, first responders and so forth, which is honestly a level up. And the difference is, as Dr. HUSTY and Dr. Sanchez says, the cloth mask that we wear in the public every day protects others around us from what we may be potentially spreading. Whereas in a hospital setting, your healthcare workers are protected by an N95 now, KN95 mask, surgical mask, to protect them from any respiratory droplets that may come their way. So, initially, I know there was concern about using up all of those supplies, so our first responders and hospital workers would not have that level of protection. Alan can speak to this. Our PPE seems to be coming back to us. We're able to actually get what's necessary for us to protect our healthcare workers, first responders, as well as the general public. And so, Alan, I'll turn that over to you.
Thank you, Donna. Yes, so part of the job here in the Emergency Operations Center is to provide personal protective equipment to assisted living facilities, nursing homes that may not be able to get those resources from their normal vendors, as well as hospital systems. Most of the hospital systems now are back online fully with their vendors, but assisted living facilities and nursing homes are still having some issues with certain things. PPE is starting to come back more readily. We are starting to get more items, although there are still some items that are challenging. Cleaning wipes, hand sanitizing type stations, gowns and N95 masks are still a little bit challenging to get. There's long delays in getting them into the center here, into the logistics staging area to push them out to the assisted living facilities and nursing homes. But surgical masks, those are the masks that are very clear. or the cloth masks like I have here are very, very simple. This is a cloth mask that I brought today, and when I'm around the building, when I'm not here in this office, in this area, I will put this mask on, and I wear the mask. This is a boring one. I also have, for my Florida Gator fans out there, yesterday I had my Florida Gators mask. There are some really, you know, if COVID did anything, and I'm sure every single person here has seen this, we have been very innovative as Americans. Birthday parties with drive-by parades in front of the people's houses. I've seen anniversary parties where people had signs and they would drive by the couple that is having an anniversary. And masks are no different. Disney has masks. You can get your favorite Disney character. Every single sports team has a mask that you can purchase. I have probably 4 or 5 Florida Gator different types of masks that you can. So there's lots of different. There is no shortage of cloth masks out there that you can get, and you can get your favorite sports team, professional or college.
Awesome, thank you.
I also wanted to add one quick thing about masks. The reason cloth masks are preferable for the general public as well is that the surgical masks and those N95 masks we use in the hospital, they have a finite life. We can't laundry those the way you can a cloth mask, which most people, when you mass produce, when most people are wearing it, you prefer something that you can reuse every day. And so those surgical masks, those N95 masks we use in the hospital, they all have an end life. And so that's why you focus on cloth masks for the public.
So I had one last thing to say on masks. Putting them on and taking them off is very important. You know, I was asked by Michelle Meredith, in my old station, TV station, WSH. I've been interviewed about 40 times because they know I'll talk. That's all. And they know that I can call Donna and get information, and call Alan and get information. In fact, I call them every time they tell me that they're going to interview me. I call them up and say, so what's going on? What do we need to talk about? So I'm kind of like the spokesperson for the group. So Michelle asked me one day, so is it important how you put them on and take them off? And I said, well, putting them on is not as important. You need to make sure it fits right, but it's taking it off. You know, you want a nice, good, tight fit, but when you go to take it off, so what struck me all of a sudden is, you know, it could be contaminated, but how do you get that picture into people's minds? And I said, Michelle, just imagine there's a little bit of dog poop on your mask. Now, how do you take it off? She started laughing and she went, I know exactly what to do now. Because we can't picture a virus, but we can picture dog poop. So, and same with your fingers. So you don't just leave the store and go and grab a hold of your steering wheel. You wipe your hands off, and then you carefully take off your mask so you don't get that anywhere.
Awesome. Thank you, Dr. HUSTY. Let's talk about where we were a few months ago compared to where we are today. What are some of the key lessons we've learned along the way with the pandemic, how it's been handled in your organization?
You trying to make me cry? Because we started off scared, and the goal was flatten the curve. The curve is not what we're really afraid of. Is that it wouldn't be a curve; it would be a spike that would keep spiking and spiking, exponential growth. 2, then 4, then 8, then 16, then 32, and 64, and 128, and 256, and that kind of growth that was just scary. And we were starting to see it, and we were certainly seeing it in other places. We flattened the curve, unfortunately, and then we got it not only flattened. Our second goal was to see if we could maybe drop this thing into the ground and make zero. But the last week or so, we've recognized that we've got a new, probably exponential growth, and we're right back to where we started. So that's why I said, do you want to make me cry, is because we were so close.
Good morning. This is Donna. So a few months ago, you know, honestly, we really didn't have a good sense of what our resource restrictions were. As Alan mentioned with PPE, we learned very quickly, as everybody demanded those resources, that they were depleted. And we had to continuously, as partners, we've ordered from the health department. Alan, of course, has ordered much more from EOC for the general community. We've pooled our resources, hospital partners. You know, we in Seminole County, I always talk to folks that we pride ourselves on our relationships, our partnerships, but with any crisis, you see people come together, and certainly it has shown true here in Seminole County, even more so. None of our organizations could do this alone. It takes a coordinated effort, and we've learned that those partnerships are ever so important, and they continue to be. We've also learned that social distancing works. You know, we did see that curve flatten. We were very hopeful. As Alan mentioned, it doesn't mean you have to have one or the other. We can do this together. We can still practice those measures and still have a continuity of operations here in our community. It's a little bit more challenging because as people congregate, we're seeing that they're less careful, but those messages have to continue to go out there. We've also learned about our laboratory resources. So many, you know, I know my mailbox is blowing up. I know in talking with Alan and Dr. Husty, they've certainly received not those messages from Nigeria, although there's a few of those in there. There's also all sorts of folks coming forward that they can make masks, they can make lab collection kits and so forth. You know, it's our responsibility as first responders and healthcare professionals to vet those vendors to make sure that we have credible sources for our community. And so, you know, that's been a little bit challenging as well. You know, we've been hit now and again with something not so credible. And so, you know, we vet those very carefully here in Seminole County, as well as with our state emergency operations center. And that's another thing that we've learned. You know, the state DEM, Department of Emergency Management, as well as ESF8, Health and Medical, you know, we have calls, gosh, daily, weekly, couple times a day. I mean, the constant communications is so important from the top down and from the bottom up. And so, you know, we have learned that communications sometimes is not perfect, and that our response at the end of the day has to be local. So Alan he's an exceptional emergency manager. We just don't know how fortunate we are to have him here in Seminole County. But through his guidance, he has maintained safety, you know, public safety with us here in Seminole County, and he's been a guiding force as we try to navigate all of those challenges. So this is ongoing. It's not going to go away. And I say, you know, every day we walk in, it's a new day, a different challenge. And so as we progress, we're looking at preparing for when vaccines do come forward for another defense in our community. That's most likely not going to happen until early next year at the earliest. But we're already preparing for those, you know, immunization pods and how we're going to get everybody protected. So lots of lessons learned along the way. I'll stop there a moment and let Alan and Dr. Sanchez chime in.
So medically speaking, this virus, this pandemic is unlike anything I've ever seen in my years in medicine and several of my colleagues. What we're used to in medicine is years of research, clinical trials, implementing things that work once we know a lot about those practices. Well, we didn't know anything about this virus about 6 months ago. And even when it hit our shores 3 months ago, we knew very little on how to combat it and what to expect from this. So one of the biggest things I learned is that we had to keep changing policies as we learned more about the virus, and we stuck to the things that work very well. And I learned that how resilient our organization is, how everybody from the doctors to nurses to our environmental services, how everybody works together if you communicate with why we're doing certain things. And we were very lucky in that we didn't get those huge surges that other parts of the country, New York, New Jersey did. So that when we did implement these policies, while we were learning to implement these policies, we didn't have those huge spikes of patients. So hopefully we can carry what we've learned with those, with the policies that do work. God forbid there is a second or third surge. So, so unlike other diseases, a lot of this we had to learn on the fly. And that frustrates a lot of people who aren't in the medical system, because they think that we don't know what we're doing. It isn't that. It's just different approach to a virus we're learning more about each day.
Certainly there are, I'll talk about some good things. Some good things that have happened over the last few months is certainly testing is becoming more available. At the very onset of this, now in Seminole County, we started talking about this in late January, early February. We were making plans. We were seeing what was going on in Asia. We anticipated it would come somewhere here in America. We were hoping it would be like Ebola. We had an Ebola incident action plan ready to go, which had step-by-step everything that everyone was going to do, even down to if a dog was infected by Ebola, what were we going to do with that dog? And Ebola never came here to Seminole County. We were hoping that that would be the case for COVID. Unfortunately, that wasn't the case. But just like Ebola, we were preparing for everything, and even down to if an animal, a cat or a dog, contracted COVID and was, and the individual had to go to the hospital, where would we isolate that cat? Where would he place the individual, the cat or dog at the animal shelter? How would we isolate that area? Things like that. So we have learned a lot over the last few months. We have learned animals absolutely can contract it, and multiple species of different types of animals have contracted it, even a tiger at a zoo. So we've changed our policies. We've updated our policies. We've been working with the Central Florida Zoo as they have also adjusted. Again, testing before was almost impossible to get a test. You had to have symptoms, you had to be very, very sick, and you could get a test. And now you can go through a drive-through site feeling wonderful and get a test for COVID-19. So much, much different. PPE was almost non-existent. It would be months before you could get some PPE. That has changed. So that has improved. Toilet paper is now on the shelves of grocery stores. Again, I do not understand. As an emergency manager, I still don't understand the toilet paper thing. I understand the cleaner thing, but I never understood exactly why every piece of toilet paper was removed from the shelves. But our supply chains are starting to come back. So that's improved. So there are things that have improved. Unfortunately, and we were improving. We were really improving on the COVID front. We had less positive cases. We were seeing the positivity rate go down, and people were getting tested and things like that. The demand for testing has gone down quite a bit as people go to work. We understand that. If you feel great, who's going to go mid-afternoon and go, gee, I think I'd like to go get a flu. Let me go get a flu test right now just to see if I have the flu. No one does that. And what we're seeing is less people are, if they feel great, are going to get a COVID test. So when some of our test pop-up sites, it's been a little bit lower than what we anticipated. We still have those available though, and we still want people to go because there are still asymptomatic people out there. So those are still available. So, but that has decreased a little bit. Our positivity rate has gone up, and it's gone up over the last week. And we anticipated a little bit of a bump because of Memorial Day as we go into phase 2. More people are starting to socialize. We were hoping when we went into phase 2 that people would socialize appropriately, that they would get back together with facial coverings and masks and things like that. And unfortunately, it hasn't been like that.
So nobody, well, you all may not understand that actually we went into this very well prepared because of Alan Harris. Alan, and I know you're very, very humble about it all, but he has been the emergency manager of the year in the state of Florida. What was that, 5 years ago? I tell everybody you should be every year. It's because Alan had drug us kicking and screaming into considering what to do about a pandemic. I can't remember how many years ago, 10 years ago, when we did a tabletop exercise with Homeland Security or whoever that was, and we failed miserably because we didn't shut the schools down. I mean, it was a lesson. It was a lesson in humility when we did that. And Alan kind of forced us to take a look at what are we going to do. That's when I like doing funny little things. So we were trying to figure out what to do about PPE, and I came up with what I call the canary. the canary in the in the mine is we send one person in to see how bad is it, and does everybody else need to suit up? Do we need to waste that much PPE on this, on where we're going? We had never really tested it, and we tested it, and it helped us have enough PPE. But that's because we had sort of been drug kicking and screaming into this. The other thing is we had aeroclaves. All the hospitals have aeroclaves. Those are units that sanitize our rescues. It helps sanitize things, that aerosolizes hydrogen peroxide, basically. And every hospital had those. So we were getting sanitized rescue units every single time we took somebody in. When you put your stretcher in there, and the stretcher gets sanitized, and you carefully take your mask off so that you don't get, well, you already told you that. So you put that on the stretcher, and it sanitizes your face mask too. So it's, all that was in place. It was in place because we had really good leadership and guidance. Thank you, Alan.
This is Donna again. I'd just like to add as well, we have learned a lot, although public health is very accustomed to contact tracing with disease reports that we receive on a daily basis. There's over 100 reportable diseases to the health department. And but this has taken contact tracing to another level. Isolation and quarantine, isolation of those infected, quarantine of those who may have been exposed for the 14-day incubation period. And our county partners, again, Alan very early on said, well, what are you going to do with folks who are at home that need to eat, that need medication, that you're telling them they can't leave their home? So he has a team of folks that reach out to those folks who are being monitored, those who are either have the infection or those who have been exposed. And they find out if they need food. They get food delivered to their homes. If they have medication needs or other social needs. Our team, we have a community paramedicine team, community outreach, and each and every time that we do a case investigation, there's someone that goes out to the home and delivers a care package with a thermometer, with gloves, instructions on how to isolate, how to keep your home safe, disinfection, and so forth. And so it's a coordinated effort, as mentioned, statewide. As we saw the cases rising in South Florida there, my question to my colleagues in Tallahassee and the Bureau of Epidemiology is, how are they managing contact tracing with thousands and thousands of cases and contacts? And initially, they weren't able to. They weren't able to keep up. We know contact tracing works as well in isolation and quarantine. And that's where you've heard, I don't know, on the news, where our governor's office, along with the state surgeon general, has hired thousands of epidemiologists to support the public health in our counties for contact tracing, because it is a heavy lift. And it just takes a number of staff. We've pulled out of our 150 staff, over half of our staff at one point in time to help with our response here. And so, it is something that we've learned. If we have, an outbreak like this, of this magnitude, we simply can't do it with the resources that we operate it on day to day.
Awesome, thank you. I know everybody's interested to see, with summer coming up, vacation plans, just trying to figure out everybody's thoughts on gatherings, if we're traveling, networking, what should we be doing to protect ourselves in those scenarios?
Well, I don't hear anybody else speaking up, so I'm not afraid. We're tired. I had to sort of research this a little bit. Donna helped me because I was being interviewed for Channel 2, and they were going to ask me the same thing about travel. And so we researched, and the hotel industry has some very, very strong protocols and procedures in place to try to keep everything clean and safe. I did read something, and Donna, I hadn't talked with you about this, because when we were talking about it before, I said, except for the elevators, what do you do when there's a crowded elevator and people don't have masks on? Are you going to get in the elevator with them? Turns out that elevators are becoming a real problem for reopening businesses, where the businesses are in 80-story buildings. Because it's like, do you really want to get on the elevator with everybody else? And so it has been a problem. So I tell people, well, why don't you go to a 2-story place and get you know, if you get one on the second floor, a room on the second floor, you're probably fine. You can walk up and down. If you're on the 80th floor, it might not be such a good idea. Or you just wait for the next elevator, I guess. Long and the short is that the travel and airlines, I think that I know some people who have still been traveling for business. They report that there's good social distancing on the plane. Yes, they refresh the air. My sister was telling me that if she has to fly, she always turns off the air. I do the exact opposite. I turn it on because I want more airflow. I want it getting past me. I will wear a mask if and when I travel again. Have things to wipe down the seat around me, etc. I don't really want to travel personally. At age 68, I probably won't travel for a while, especially with this. We're seeing a second spike all over the country. So I'll probably wait to see what happens with that. So that's, again, if you'd asked me about travel a week and a half ago, like Wes did, I was much more optimistic. Right now, I'm a little more pessimistic about travel until we see what's coming up.
So with travel and any activity that you do this summer, I think the same rules still apply because the virus is out there. Social distancing, able to wash your hands, being able to stay away from people. One of the biggest advice I try to give people is be ready to cancel whatever you're doing if you're feeling sick or anybody in your party feels sick. I know as humans, when we commit to something, we like to stick to it. A lot of us power through. We've been taught that our whole life. If you feel sick and if you feel a little bit sick, if you can handle it, go do it. That's not the case during this pandemic. If you have a cough, if you have a low-grade fever, even if you feel relatively well, I would suggest having a low threshold to cancel anything you're doing so that this way you don't spread this virus in case you have it. Or if anybody in your party has it, you don't catch it from them.
Awesome, thank you. You have something, Alan? Well, this question is for you, Alan. With hurricane season approaching, is there going to be a different response when it comes to if a hurricane happens and we have to evacuate? What is that going to look like with COVID-19?
Yeah, absolutely. So absolutely, things will be different. First, a couple of people said some really nice things about me, and I really appreciate that. But it is just because we have an incredible team here. We have an incredible medical director. We have an incredible health officer that works very, very closely with our office here in emergency management. We have an incredible relationship. I hear from other counties about the relationships between the cities and in the county. That is not how it is here. We get along so well with our cities. I see County Manager Bonaparte on here, as well as I'm sure some other city managers. And every time we do any type of action, all of our city managers get together with the county and we discuss it before any action is taken. We just have such a wonderful working relationship, and it's just easier to deal with something like this kind of crisis when you have such a wonderful team that is willing to support each other, from first responders to the sheriff's office to animal services that was willing to jump in with a sick COVID cat, to whatever the case was, whatever the question was. It was not I can't do it. It was how can we make this happen? So it is a wonderful team. As we get into the hurricane season, it's the same mentality. You know, when we've been talking about this, it's how can we do this? How can we socially distance in persons with special needs shelter, which is actually run by the Florida Department of Health. And Donna and her staff with my staff went out to look at a couple locations yesterday to see how we can do that. How can we help our most vulnerable patients? Normally, you've all seen the pictures, right, of shelters where people are side by side in these large gymnasiums and cafeterias and schools. It's not going to be like that this year. So how do we socially distance individuals? How do we make sure that we have enough staffing so that now that they're in a whole bunch of different rooms, they still have to be monitored, they still have to be checked. It's much easier to look around a gymnasium and see if anyone's not doing very well, but now we're having to go into individual classrooms, and we're having to look in other buildings and things like that. So it requires more staffing, it requires more planning, even down to sandbags. So in our sandbag locations where we would give out sandbags, we're still going to give out sandbags, again, a partnership with all of our cities. Every single one of our cities has sandbag locations as well as we do, because we do live in Florida and there are flood zones, of course, in Seminole County. But now we have to look at social distancing at sand piles, a queuing of lines, where we used to have shovels available for anyone that came up to fill their sandbags. This year it's BYOS. Bring your own shovel. You have to bring your own shovel. We will not have the shovels there because we don't want, the worst thing that could happen is someone gets sick and a hurricane happens. I can't even imagine going through COVID-19, feeling miserable, and having a hurricane on top of me with damage to my house. I just can't imagine that. So we want to prevent that from happening. At a general population shelter, we're working with our Seminole County School Board. Some of the teachers now and administrative staff will be helping to staff the shelters. We're looking at school nurses to provide medical assistance at each one of those shelters. So a lot of different types of services that before you could just put everyone in a gymnasium. Hey, everyone, we're going to have lunch at 12 o'clock. Y'all all come up here to the cafeteria and huddle together, and we're going to have a nice time. We used to have a room where you could go in and you could watch the news or a movie at night. So it's a little bit more comforting. Now we can't have these people gather together to watch a newscast on a projector. Everybody has to be socially distanced. Everybody has to be separated. Facial coverings and masks at the shelter. Temperature checks before you even walk in the front door. Questionnaires about have you been in contact. A COVID-19 shelter. Never have we had a shelter for sick individuals. We've had isolation rooms inside of the shelters if someone gets sick, but we've never had an entire shelter just for sick people. So that's something that we're going to look at this year, something that we're going to open. So a lot of different changes. People require transportation sometimes to get to a shelter. Before you get on that bus, you're going to have your temperature checked. You're going to have the questionnaire. Even before we dispatch the bus to go pick you up. Our evacuations will be called much, much, much earlier. So you're going to think we're crazy. You're going to think, man, Alan has lost his mind. It's sunny outside and he's calling for an evacuation and the storm's not supposed to be here for 48 hours. Well, it's so that individuals that are retired, individuals that can get out of the way of the storm, that we want them to get out of the way of the storm. We want them to beat the traffic. We want them to get to their friend or family member's house in a concrete masonry block home, be there, be safe before those that can't evacuate early start to evacuate, because we know what happens then. The traffic gets bad, things like that. We have learned our lesson. I hope we have learned our lesson in Seminole County. We know where the reporters will be before a hurricane. We've been through hurricanes before. And where are they going to be? They're going to be in front of the grocery store and the hardware store. And what are they going to show? Empty shelves. Well, we learned it in hurricanes, and now we learned it again in COVID. Before something happens, everyone goes out and panic buys. So let's buy the supplies now. So we're encouraging people now to go get supplies. We also understand that this is an economic challenge, right? People have gone through COVID-19. Some of them have lost their jobs. My household was half furloughed, so we had half the income that we normally do come in. So I get it. But for those that can afford disaster supplies, we're encouraging people to go get disaster supplies, again, for those that can. What that does is it allows the supply line to refill for those people that can't and that have to buy it right before the storm because they just simply don't have the money right now to go get the disaster supplies. So allow them to have the opportunity to get their disaster supplies as the storm is approaching, because you'll be all set because you already bought yours now.
Thank you, Alan. I know now it's time we're going to open it up to questions. Georgia, what questions do we have for the panel?
All right. Thanks to all the panelists. Thanks, Jeremiah. And I see Harry Ellis's comment, get your toilet paper now. So everybody just keep that in mind. Okay, so first question, we'll dive right in, is how up to date is the Florida COVID-19 dashboard? Does Seminole County have a designated reporting officer to the Florida Health Department, or do all hospitals report for themselves?
So I can start in that response, and then I'll let Dr. Sanchez speak on the hospital perspective. But in the state of Florida, our public health system is an integrated system. Unlike some other states, we don't have local boards of health. So all 67 county health departments report up to our state health office in Tallahassee. they are the keepers of the dashboard, if you will. You know, all of the data, the reports that we receive is through a system called Merlin. Every health department has access to that database. We are in there doing case investigations, entering data, and so forth. The dashboard was created through the Bureau of Epidemiology in Tallahassee to data mine, if you will, all that information from Merlin. But at the local level, we have access and control over what data is in and out with our particular cases. At the very beginning, I would say through a good portion of this response, the dashboard was updated twice daily. Now it's updated in the morning around 11:30. But that doesn't mean that we don't have access to the data for Seminole County. We're in it, you know, Alan, we have someone stationed over there at the Emergency Operations Center from Public Health who can go in and pull just-in-time, you know, reports for Alan, as well as our epidemiology team here that can pull just-in-time reports. So in the event that we start seeing trending as we did the other day, we pick up the phone, we have a conversation, we strategize on what we need to message to our community, and hence press conferences that you see for educational purposes and awareness. So there has been, you've heard in the media, the database and reports are not perfect. We do get every morning before 8 o'clock, we get some preliminary data for each of the county health departments to review for accuracy before they publish around 11:30 every day. And those reports include deaths in your county. So we confirm whether or not the person who entered that information in Merlin entered it correctly. And so what you see on the dashboard is pretty accurate, but like I said, it's not 100% perfect. And sometimes their systems go down. So they tell us, you know, well, you'll need to access this through this particular portal because we're working on IT here to get the system back up again. I will tell you though, in all the years I've been in public health, which is close to 33 now, that this is the most transparent that we've ever been with our public about outbreaks. So you pretty much get everything we get, you know, except for a person's name, but you get their age, race, zip code, ethnicity. You know, you're getting pretty much everything public health is getting, bar protecting a person's identity and their personal information. So, you know, we early on also worked with Alan and Dr. HUSTY to make sure our first responders were aware, and we're still doing this, aware of any particular residence where there might be a person exposed to COVID or someone who had COVID. They didn't get a name, and they still don't get names, but they get an address. That way they know that if they do respond to that particular address, that they need to make sure they have use extra precaution. You know, their personal protective equipment, their usual operations are to protect themselves each and every day, but they'll be aware that there is a, you know, you need to enhance precautions here at this particular residence because somebody may be infected.
Okay, thank you very much for that. Next question is, what do we currently know about those that test positive for COVID-19 antibodies? Will they not get reinfected with this strand of the coronavirus? Just general questions about antibodies and just how effective that is.
So I do get this question a lot about antibodies. Now, one of the first things that everybody has to realize is there are many different kinds of antibody tests. Different companies have chosen to direct their tests against different parts of the virus. So not all antibody tests work equally. I've seen in the literature tests that are only 30% accurate to those that claim to be 98% accurate. So that's a very wide range of accuracy across all of these tests. What we do know is that what we do know about these tests with these antibodies is that that even the people who do get or who test positive, we're not sure about a couple of different things. First of all, number one, is it a true positive? Meaning, are they showing up positive for something else? And secondly, even if they are positive for this particular virus, we're not sure yet how long they will be positive for, they will have antibodies to this virus and how effective those antibodies are. We can infer things from the other coronaviruses. As many of you probably know, this isn't the first coronavirus that we know of. There's 7 other strains, two of which caused local epidemics, MERS and the original SARS back in 2003. We know those viruses people infected with those viruses carried antibodies for up to 1 to 2 years. This one, we're not sure how long it's going to be. This virus has only been around for a few months. And secondly, we don't, with some viruses, even if you carry antibodies for it, you can still get reinfected, many times at a less severe rate, with less severe symptoms, but we're not sure about this one yet. So the bottom line is, even if you test positive even if you have positive antibodies, you still need to continue all of those social distancing tools, hand washing, as if you didn't have the virus to begin with.
And I appreciate that, Dr. Sanchez, because I get asked all the time, should I get antibody testing? And very short and sweet, no, it doesn't change anything right now, unless you want to donate your serum, convalescent serum, to help treat people with it. The blood bank will actually run your antibody tests and your COVID test for you if you're going to donate blood. Other than that, it really doesn't change anything. It doesn't change whether you should be exposed or not, as Dr. Sanchez says. You let your guard down? No, because you don't know that you have any kind of immunity at all. 3-4 months from now, we're going to have more information. I think we're going to know which tests are the good ones and which tests are real positives are positives and negatives are negatives. And 3, 4, 5 months from now, yeah, I think we're going to see widespread antibody testing, but it doesn't do any good today. You still need a COVID test even if you turn positive for antibodies, we don't know that you're not infected right now.
Thank you, Dr. Husty. Our next question is probably something that a lot of us are thinking about. How concerned are you, the panel, of a perfect storm happening this year when the flu season kicks in, along with another potential wave of COVID-19?
Okay, I am going to cry. I'm pretty sure, we're pretty sure, I think, that this is going to return. It will not totally get out of our communities. If you look at what's happening right now, I'm absolutely certain that it will not go to zero and disappear forever and ever and ever. It will probably return in the fall. It seems to be likely to be seasonal. That means that we need to be prepared. We need to we know what to do. But boy, with the flu hitting at the same time, yeah, we could see a lot of illness. Of course, we can treat the flu, and I do have optimism for the fact that we'll learn better. And Dr. Sanchez, you might approach this, is how our treatments for COVID-19 might get better before we get a vaccine. I mean, sort of the remdesivir, et cetera, some of the things that seem to be working. There's a lot of energy going into trying to find treatments. So when we think about the flu, I used to go, oh, geez, you got the flu, you're SOL, so, and instead now we go, oh, we have things to treat the flu with. And it's a sort of a different world than it used to be. I'm really optimistic that we're going to come up with something to treat COVID-19 with that will help people, and fewer people will get ill or get seriously ill. What do you think, Dr. Sanchez?
Oh, thank you. So one of the things that we have learned, one of the things that we're learning and that we have learned are several ways, even if we don't totally stop coronavirus, that we kind of come up with treatments, at least to prevent the most severe symptoms. The most recent things that's really hot right now is remdesivir, as Dr. Husty said, and there's a big trial that reduced the amount of hospitalization days from 14 days to 11, which doesn't sound like a lot, but it is a lot because that's 3 days less of PPE, 3 days less of sickness, and combine that with how many people get coronavirus, that ends up to be a lot of hospitalization. Now, and we hope that as time goes on, we learn more about other modalities that we can do to stop the spread of disease or to decrease the severity of coronavirus. But I do want to say one thing about the influenza, because I've heard this from the beginning, especially in the beginning, when people said, hey, this coronavirus is nothing but a bad case or a bad strain of the flu. And I didn't like it for two reasons. One, first of all, we know this is much more infective, and the flu strain and the flu has never caused 120,000 deaths in 3 months in the country. So this is much more severe than that. And secondly, what really annoyed me more is that we shouldn't disregard coronavirus because we shouldn't disregard the flu because coronavirus is worse. Yes, yes, coronavirus is worse, but there's things we can do about the flu, and so we should vaccinate, and our vaccination rates are abysmal as a whole in this country for influenza. And so instead of saying, well, coronavirus is just like a bad case of the flu, let's do something about the flu so we have less cases. We have less cases of illness throughout in this flu season anyway.
Thank you, Dr. Sanchez. And just to wrap things up, we want to, this will be our last question, talk a little bit about positively moving forward with everyone having sort of a different comfort level now that things are opening back up. Just to hear from each one of you, what steps are you taking to sort of instill confidence in our community that it's safe to get back to work, to gather in groups, and of course, rebuild our economy, which is a big concern for a lot of us?
Well, we in the county leadership believe that we can do both at the exact same time. We hope that individuals will continue to social distance. We hope that people will use facial coverings and masks. I can tell you at my grocery store, I went there yesterday, 65%, maybe 70% of the individuals that were in there had facial coverings and masks. That was very comforting for me. Everybody was very respectful of the queue lines. The queue lines, we hope that that continues. We hope that people will social distance. We had an incredible conversation with our faith leaders. Over 120 churches, church leaders were on. We had a couple different webinars with those individuals where we could talk back and forth, faith leaders to faith leaders, as well as us here in emergency management, talking about safe ways they can reopen. And a lot of those are moving forward with very, very safe activities. We've been very innovative. We've seen innovative things, and we hope that innovation can continue. The challenge is going to be complacency, people getting tired of the COVID, if you will, and going back to the way it was 4 or 5 months ago. And if that happens, and it has started to happen, how do we know it has started to happen? Looking at the numbers. The numbers are just past me right now, and just since we've sat here, I've seen 10 new cases pop up on the screen. So, and every couple minutes, another case pops up on the screen. So it's alarming to look up there and just see an additional number, an additional number, an additional number, and it just keeps happening. And so we know that we can prevent the spread of this. We know that we can reopen safely, and we hope people will. And I think that's the message. And if we push that message, if us as business leaders push that message in our businesses, you know, it's to our best interest, right, to do that. I can tell you personally, and I think that it's echoed, you know, if I walk into a restaurant and I look around and the servers don't have facial coverings on, I'm not complaining. I'm leaving, and I'm not coming back. And I'm not coming back for a long, long time, if I'm coming back ever. So that's the message, you know. The people aren't going to complain to business leaders. They're not going to complain to business managers. They're just not coming back. And you certainly don't want to be the bar that is known as the COVID hotspot. And there's a couple of them now. So that's the message. You know, the message is we can reopen. We can do this safely. We have the ability, and we can do it.
This is Donna.
Can I just say, I totally agree. And I have a couple of restaurants that I'm not going back to because that I tried reopening. I did take my N95 and went in, and when my server didn't wear one, I actually took them N95 masks to wear, and she chose not to wear it anyway. She said she didn't mean to be disrespectful. I said, but you are disrespectful. It is disrespectful. If you don't wear facial covering, you're disrespecting everybody else you're around. I'm done.
And this is Donna. you know, early on, as we prepared in late January, February, we started communicating with different groups in our community. And it was very important, and it will be very important, that we continue to raise awareness in our community. The press conferences, the daily reports, press releases, the hotlines or call centers that we have at the EOC and here at the health department. It's so important to keep our community informed of what's happening with this virus and how it's affecting our community. I agree that, you know, certainly we can take these precautions to help spread it. We are seeing, because people are letting their guard down, that we're seeing an increase in cases. You know, the virus is still here. It's not gone away. It is, if you will, a new normal for us. You know, I think Dr. HUSTY was an early adopter of masks. And he mentioned this, you know, gosh, several months ago. Like I said, the concern across the nation and worldwide was that we would deplete the supplies that our first responders and healthcare workers needed to protect themselves when they knew that they were in front of somebody with COVID. It's a different day. You know, we have the ability to provide for everybody. You know, we have creativity and innovation like Hanes. We just received, gosh, over 100,000 of these cloth masks from Hanes, who repurposed their factory so they could provide 2-ply cloth masks to anybody who may not have them. We're getting those out in the community because we understand not everybody can afford to buy masks. So we're reaching out. And by the way, if you know of anyone, please give us a call, because we can request more masks for our community if there's a need. So in my opinion, increasing awareness, constantly communicating with our community and our partners of the evolution of this virus and what's happening and the precautions we need to take. It's going to take all of us. And I know we say this time and again, but we can do this together. We certainly are not turning a blind eye as we reopen. We're doing this cautiously, although some are doing a little bit faster than others. And we're putting the brakes on a little bit here. But our community is not going to know unless we reach out, unless we communicate. So it's going to be more than a few months. This is going to be at least a year, if not longer, that we're on this journey. And we just need to stick together. You know, looking back at H1N1, which is a different virus, of course, a flu virus, but that was thought to be the pandemic, the one that we were waiting for 100 years. And fortunately, it was not as you know, deadly as originally thought. This virus is. And so, you know, that particular response was at least 2 years long, even with Tamiflu, and vaccine. So we just need to continue to communicate with each other, work well together, and address our community's needs as they come up.
So I wanted to discuss going forward from a hospital perspective. One of the peculiar things that happened during this COVID-19 pandemic is how people stopped going to the hospital. And so we saw a number of our ER visits go down, number of our primary care visits go down. People stopped seeking care because they were worried about getting COVID-19. And of course, while COVID-19 still remains a very concerning topic and the cases are increasing, one of the actual safe places you can be is at a hospital, because the moment, at least in our institution, the moment you walk in through that door, you will be screened for COVID-19, both with questionnaires as well as a temperature check. And if you are positive to any of that screening, you are isolated, and that's when isolated. And if you need to be admitted, you'll be admitted. Now, a couple of things that we've seen are people who choose to forego care when they have symptoms, and they end up with illnesses that are much more complex and worse than they could have been if they had come early on in their symptoms. For example, we've had people with perforated appendicitis. We've had people who stay home with a little bit of chest pain and it turns out to be a heart attack or myocardial infarction. And when they come to the hospital, they've required emergency surgery and care. So going forward, this virus is going to be with us for a while. Please don't stop seeking your care. The hospital is safe. We've done everything we can to keep the hospital safe as it can be. And so if you need care for any other symptoms besides COVID, come see us.
Well, thank you all for your, letting us have a little bit extra time, and also for your informed and thorough responses, and also to our participants for the great questions. So I'll just throw it back to Dawn to wrap things up.
Thank you, Georgia. And thank you, Jeremiah, also for doing a great job facilitating today. I want to thank our esteemed panelists, especially for your transparency and for your valuable insight into COVID-19. Thank you so much. I hope you know how much we appreciate your leadership. It's very meaningful to everyone in Seminole County. I want to thank our sponsors again, Orlando Health South Seminole, as well as Professional Real Estate Company. And I want to thank each one of you, our alumni, our community partners, for joining us today for this important program. And I just wanted to ask everyone, if there's something that you would like to hear about, and have Leadership Seminole make it a topic for a coffee conversation or lessons on leadership, please reach out to us. We'd love to hear. Always looking forward to new and great ideas to share with the community. With that, I wish everyone a fabulous, beautiful weekend. And thank you again for being with us today.